Hi, my name is Danielle, and I would like to introduce you to Nadia, the head doctor at Lymphatic Clinic in Perm, Russia. Dr. Nadia is an MD and PhD and a professor of anatomy and lymphology. She also has her MBA, which she got so she could ensure high-quality service at the clinic that she founded. Dr. Nadia has been successfully treating patients with illnesses from arthritis to plaque in the arteries for almost 40 years. I heard about her and this approach from a good friend, and although it's taken me a little bit to connect with her so I could find out more about the clinic and the lymphatic system, I'm finally here. I'm anxious to see how all this pertains to me.
Hello, Danielle.
Hi, Dr. Nadia. Thank you for taking the time to meet with me today. I'm really grateful that we have the opportunity to use technology to connect and to start the process of finding out more about the Lymphatic Center. I've heard really great reviews of your work, and I want to know more. So thank you for taking the time out of your busy schedule to record these sessions with me so that I can create a documentary and share it with other women about the lymphatic system and about my journey to better health.
Thank you for meeting, Danielle.
It's very good to meet you. So I've understood from my friend that the work that you do is not typical and that you have 9 patents for treating illnesses from the arthritis that I talked about to the clogged arteries. And I'm wondering if you could tell me a little bit about how you got here. Why did you decide to become a doctor?
I decided to be a medical doctor since my childhood. My parents wanted me to become an architect. Why? Because, when I was a kid, I liked to draw a lot. I liked to draw very much. And they saw this and wanted me to become an architect. And my school teacher wanted me to become a school teacher. But I have the decision for my life to be a medical doctor. What's the reason? I have an elder brother, and unfortunately he suffered from epilepsy, and I saw his suffering and wanted to help him. And it was a very simple way to the medicine for me.
So your brother was your motivation?
Yes, it was motivation for me. And from...
Well, that's pretty wonderful.
Yeah.
That's great.
Yeah, it's great.
And were you able to help him a little bit?
I was able to help him very good.
A lot then. Oh, good. Okay.
For his life. And in 1980, I received my medical doctor, and I did my PhD in 1996 in St. Petersburg. And now I full-time clinical practice. I'm a head doctor in my clinic for a long time. For 27 years, I had been chief at the anatomy department at Penn State Medical Academy, teaching thousand students and doctors. And I received professor at local academy.
That's right. So you're a doctor, you're a professor, and you're a business owner. I mean, you opened up the clinic yourself, right?
Yes, I am. I'm a doctor.
Okay. So why did you open the clinic?
When I was 30 of age, I understood this public health care is a mess. Why? They divided human being on several parts and tried to treat them separately. So I wanted to create a place with a holistic and logical approach a place that is not limited by standards and insurance policy, a place where the solution in the health is important. Solution focused, not drug focused, symptom focused.
Oh, okay. So I think my friend told me a little bit about your approach when he said that you don't really look at the symptoms. You really try to find the root problem when you talk to a patient. Is that true?
Yes, it is. It's true. It's right.
And how did you stumble upon this? Like, how did you figure that out?
I think the reasons are always logical. And we just need data to identify them. We spend time with my patients for 2 or 3 hours. It is first visit. What we do? What do we do for the first meeting? We learn things that patient doesn't like, complaints, collect medical history, family history, his diet habits, beliefs, at least stress level. We analyze all it and understand possible reasons. Then we do some tests to confirm or to deny. After that, we put it together with my patients and draw a tree of reasons for every health issue and connection between them. And we just need to know anatomy and physiology and spend time with the patients, a lot of time, 2 or 3 hours. And first of all, I listen carefully, very carefully. All my doctors in my clinic listen every patient very carefully and try to find the reasons of illnesses.
So that gives you greater success because you're focused not on what drugs to give or not on what symptoms, but you use the symptoms as your roadmap to find the cause.
We look for the cause. We are looking for the reasons of illnesses, and it is great success among the people, among the patients, because everybody wants to know the reasons of symptoms.
Absolutely.
Yes.
I think that's why we go to the doctors, right? We have a symptom, we want to understand, well, why do I have that and how do I fix it? So you are in the business of fixing the problems.
Ensure that patients need knowledge of reasons, because the symptomatical treatment is not good way for patients, because modern public health can treat just symptoms. It's not good ways.
And how does all of that connect to the lymphatic system? I guess for me, I have never really heard a lot about the lymphatic system. I've heard about the nervous system, the cardiovascular system, the endocrine system, but the lymphatic system, I've never really heard about. Can you tell me about that?
Many do not understand the role of the lymphatic system in our organism, and that is why they devote very little time studying it. But lymphatic system is much more than just drainage and detoxification, and it is also headquarters for our immunity. It doesn't work properly, it will affect every piece of health. By the way, it is hard to discover it. Blood is red, but lymph is transparent, clear liquid. And the problem is our medical students don't study the lymphatic system as a subject, and that is why medical doctors don't have the knowledge about lymphatic system.
So when you decided to become a doctor, you decided to become a lymphatic specialist?
Yes, lymphatic system has a main role in the beginning of illnesses, in the clinical course and outcome of any disease. And for 40 years, the lymphatic system was being in a main focus of my research. And now I know its role in our organism and how to treat through the lymphatic system.
And you have international clients, right?
We have international patients from the Great Britain, from the USA, from Singapore, for example, from different parts of the world.
So they come to you and they're able to get the care they need, and then they go back home.
Yes, international people come to our clinic, get treated, and come back home.
And can you tell me just a little bit about what do your patients say after how they work with you? I'm a coach, so when I work with people, I ask for feedback. I say, so how is the experience for you coming to me? And they'll give me words. They'll say transformational. I can find my answers. I feel so much more grounded. My life is changing. I'm making decisions. What do patients say after they come and they work with you?
As usually, my patients say, we are happy to meet you. You're my favorite doctor. You're my alone doctor, and we are friends. Most of my patients are my friends, good friends, and we celebrate our birthday together. We celebrate different holidays together, and every patient is part of my life, is part of my heart, is part of my clinic, and they're very comfortable in our clinic, and they say it's not place for illnesses, it's place for health.
So your clinic is the place that heals people.
Yeah, it's place for health.
And gives them their health. Very good. Okay.
We can stop.
So
we can stop illnesses. We can stop illnesses. It's place for health. Holistic health.
And
in spirit, in soul, and body. Because every consists of 3 main parts: spirit, soul, and body. And
you take all of those into account when you talk to a person. You're thinking about all those parts of the human being.
Yeah.
So I'm in Moscow right now, and you're in Perm, and able to start the medical conversation online together.
Yeah. Yes.
So that's possible for you to do? Your staff has time to meet with people online?
Yes, it is. It's possible because it's our regular practice in our clinic to speak with our patients, potential patients, by online. And after that we have conversation by Skype or by email, and our patients can send us medical documents by mail. And
okay. That's pretty flexible. I hear a plane. Is there a plane going by?
Yes, it is truck.
Yeah.
It is military craft.
Oh, military aircraft. Okay. All right. So the process then for me will be to kind of do an email, and then we'll start to talk back and forth. I even want my husband to be able to come too. He doesn't know that yet, but I want my husband to be able to come too, just so that we can, I think, be proactive as we age. We have a few things going on that I think need to be looked at, so I want to kind of gather that information. So I can understand the lymphatic system better, because I don't know anything. Where will we start? Can you spend some time teaching me about the lymphatic system?
I think we can start for discussion a very important problem about nasal congestion, because it is interesting. A lot of people think that nasal congestion is normal part of the life, and they haven't 100% freely breathing and think that is normal part. And we can start with this topic, this problem, medical problem, because nasal congestion, or how we can mouth breathing, is main symptom behind very serious illnesses, such as
Like what?
yes, such as it's symptom behind very serious illnesses, such as snoring, depression, and heart diseases, and so on, including abnormal weight. Nasal congestion is main symptom. Yeah. As for children, it would be the symptom of hypertension, intracranial hypertension, and we can see hyperactivity in our children, modern children, and it's symptom of very serious illnesses. And we can start with this topic.
Okay. As a child, my nose was always stuffed. I always had allergies, and I think I breathed a lot through my mouth as a child. I taught myself. I remember I was a young adult, and I taught myself to close my mouth to breathe at nighttime to go to sleep. But I had never heard that whatsoever. Okay. So that's interesting. So you're saying that nasal congestion can make a child hyperactive?
Yes, it is the reason of hyperactive of the children.
And you consider snoring also an illness?
Yes, it is. Snoring is a consequence of nasal congestion too.
That's amazing.
Yes.
Okay.
Obesity is a consequence. Obesity is a consequence of the nasal congestion too. And
obesity.
Okay. Obesity. And we have such patients in our clinic.
Okay. So, here's another question. So how will you be, because I don't even know what the lymphatic system looks like. I have no idea. Like, I know what blood looks like, but I don't know I don't know anything about the lymphatic system in my body. How will you be able to teach me a little bit online? So I'm using this kind of as my test to come out there or not. So I like to do my research. I like to know the information in advance. How will you teach me when we're so far apart? Are you going to draw for me? Are we just going to talk? How will you teach me?
Well, it's very simple. I can draw on my desk in my office. I can show you some pictures, some presentation, for example.
So then we will start with nasal congestion, and that symptom that's in our body, that it's connected to the lymphatic system, that we can take a look at.
Yes, I'm ready to share. I'm ready to
that's
share.
Wonderful. Perfect.
With you, with the women of the world.
That's really
all over the world.
Dr. Nadia, thank you for your time today. I'm very excited to learn more about the lymphatic system. I never thought I would say that at 50 years old, that the lymphatic system is what I'm interested in, but I am very interested to learn more. I really want to know more for myself and my own health, and I have grandchildren now too, so I want to make sure that that my grandchildren are taken care of, because I love them, and I'm really grateful to be here with you. Thank you very much.
Thank you for meeting. Thank you very much for your time.
Oh, I'm not a doctor, so I have more time.
For your teaching English.
For our practice in English. Yes, no, it's unfortunate that I want to share these with women, English-speaking women, because I would love to just have the whole conversation in Russian for me, so I can, get my Russian better. But that's okay. Next time, that'll be good for us. So let me tell you everything I like already about Dr. Nadia. First of all, she's a beautiful woman. She's got a great smile. I love her heart. Her heart is for people. And I can feel that all the way, thousands of miles away from my own home office. I am looking very much forward to meeting her and give her a hug. I feel like she understands me. I love how Dr. Nadia listens. She listens very carefully, and I can see how her mind works. Her mind is taking in information and putting it in the slots to try and figure out the puzzle. I think that's an amazing gift that she's been given.
Okay.
Okay.
See you
Thank
next
you.
time. Thank you. Thank you very much.
My name's Danielle, and I'm here with Dr. Nadia, and I just want to say thank you to Dr. Nadia for taking the time to be with me today, to start to explain the lymphatic system to me today, so that I can prepare myself for an eventual visit to her clinic in Perm, Russia, the lymphatic clinic. For over 40 years, Dr. Nadia has been treating people from illnesses from arthritis to clogged arteries, and she has 9 patents, and she has been healing people with her unique approach. So we are here to do a recorded session, kind of like a documentary journey of my relationship with Dr. Nadia, along with me finding out what I need to discover in myself to create a healthy pathways for going for the future. I plan on living till at least 90 years old. I'd love to live to 190 years old, but I know that I need to take certain steps in my own life to make that happen. And so I hope you'll join us again, and see you next time.